Before applying the vertical drain tube attachment device, the patient's skin should be clean, dry, and free from oily residue. Remove the device from its sterile packaging, along with the illustrated step-by-step instructions. Peel the release paper from the skin barrier, but leave the release paper on the tape border in place. Feed the tube through the slit in the skin barrier and position the tube in the pre-cut starter hole. If necessary, the starter hole can be enlarged to accommodate larger tubes or skin openings. Press the skin barrier in place. Then smooth out any wrinkles in the barrier. Remove the release paper from the tape border and press the tape against the patient's skin. Next, wrap the serrated strap around the tube and push the strap into the tube holder latch. Pull the strap through until it fits snugly around the tube. The strap should be tight enough to hold the tube securely, but not so tight as to cause occlusion of the tube. Now simply fold the strap over and tuck it into the base of the mechanism. Do not cut the strap. You will need the extra length of strap when you remove the device. The device should stay in place for 5 to 7 days. While it is in place, follow all clinical protocols for placement, monitoring, and removal of percutaneous tubes. When it's time to remove the device, first pull out the extra length of strap. Then squeeze the sides of the latch to release the strap. Pull the strap all the way back through the latch while continuing to squeeze the sides. Next, lift a corner of the microporous adhesive and gently press against the patient's skin to break the adhesive bond. Then, simply peel the tape and barrier from the patient's skin. Hold the tube in one hand and remove the device.